Hello, I'm Susan Regan, host of Connecticut Valley Views, and I am delighted today to have as my guest Dr. Jane Anderson, MD, who has graduated from the University of California in Los Angeles School of Medicine and obtained her pediatric internship at the University of Southern California. And her residency was at Stanford University, and she practiced for 33 years at the University of California, San Francisco, as a clinical professor of pediatrics until her retirement in November of 2012. Now, I know you have a longer biography than this, so please give us a little bit more, fill us in a little bit more about your background and why you are providing us with some important information today about the transformation of our youth.
Well, thank you so much for having me. I'm really grateful. Yeah, my background is in general pediatrics, and I did teach the medical students and the pediatric residents at the University of California, San Francisco, and I had my own practice there. UC San Francisco, as you may well know, is one of the first places in the country to have a transgender clinic. And when I first sort of heard of this concept, it was at a medical conference that an endocrinologist from our university was speaking at, and he was one of the most compassionate and really conscientious physicians. And yet he was promoting this gender ideology that is really, I'm sorry, it's a mental delusion.
Yes.
And I really could not figure out how physicians who treat children and adolescents with, for instance, eating disorders, and they know it is a mental health problem, and they do not let them go home and say, I'm going to continue to lose weight until I starve myself to death. They don't. They put them in the hospital and they make them have psychiatric care and they feed them. And I couldn't understand how the concept of transgenderism was being treated any differently.
All right, so as a board member of the American College of Pediatricians that urges physicians to strive to bridge the parent-child communication, adolescent confidentiality notwithstanding, what would you say is, since we're talking about transgendering here, we're talking about parents having their children exposed to this type of indoctrination, if you will, in schools, and some states more than others, and some, I don't know, I want to say boards of education support it, depending on the commissioner of education in that state. What do you see is the greatest risk for not only parents, because they certainly don't want to see their children harmed, but for the children themselves? If you can take us from, the first adolescence and the indoctrination in the school and the saying, maybe you really shouldn't be this. What do you see as the greatest risk?
Well, there are several that I think parents, teachers, everyone needs to be aware of. The first is what you mentioned. It is definitely being indoctrinated in the schools. And let's not fool ourselves. It's happening for kindergartners. It may even be happening earlier than that, but at least in public schools, it is happening in many kindergartens where they are being read stories about how little Johnny can become little Susie, and or you can feel like a girl one day or a boy another day, and it's all okay. And kindergartners are being transitioned in schools. That happened in California, in Northern California, where a kindergartner came home and cried to her mom and said, she was a little girl, and said, "Am I going to turn into a boy?" And her mom was like, "Where did that question come from?" Well, it was because a child had come into their classroom who had been, a girl previously and was presenting as a boy. So parents need to know this is happening. You need to be aware of it. You need to get into your school's curriculum and dig deep, because they're going to hide it. I'm sorry, but many will hide it from the parents.
Yes.
Secondly, I'm sorry.
No, go ahead.
Secondly, social media is a travesty and damaging for our children and our adolescents. So parents need to know that if a child or young person posts on one of the social media sites, particularly like TikTok or Instagram or one of those sites, and says, oh, I'm feeling a little sad today, they are going to be bombarded by people saying to them, maybe you're transgender, maybe that's why you're unhappy. And they will be immediately befriended, and they think then they have relationships and they have friends with people who are going to support their transition. So these children are definitely being recruited. They're being indoctrinated by the schools. They're being recruited by social media. And in my mind, the best thing parents can do is keep their kids off of it, as long as possible.
Homeschooling. How about homeschooling? Get them out of the milieu.
Well, we could go there, but I just want parents to know. And one of the books is on detransitioners, and it gives the story of 5 youth who detransitioned, and every single one of them was recruited and promoted and encouraged to go along their transition pathway because of social media. So it's huge. And it has so many other damaging effects for youth. It causes depression, especially in girls, many other side effects of sort of using social media. But today we'll focus in on they recruit children and youth for the transgender ideology.
What do you suppose the purpose of all of this is? I mean, they tend to stand behind the defense that, well, we want people to be themselves and the freedom to choose of who they want to be and how they want to present themselves. I don't understand the long term, what their objective is long term. I mean, they say they're defending the children, supporting the children because they're giving them this freedom to do this. But I also don't understand where they get the idea that they have the authority over, let's say parents are very much against it. Let's say that a parent says, I don't like what's going on in the school, and I don't like the books that you have in the library, and you had someone come in and give us a special presentation on this and so forth. Parents don't seem to have any authority anymore. It's as though that's been taken away from them, and the school is going to dictate exactly what they're going to have in school and what the lessons are going to be and who's going to come in and speak. And I don't understand where they've taken that right away, because it's part of our Constitution.
Yeah, it's a very sad thing. It started happening years ago. Even in the 1960s, schools were being used to indoctrinate children and youth into anti-Americanism and against capitalism. I mean, there's a lot of things that have been going on in our schools, but definitely President Biden's administration and the FBI targeted parents when they were at school board meetings. I mean, we know that. And we just have to say right now, the American College of Pediatricians applauds President Trump for stating the biological fact that there are 2 sexes, right, male and female. That's reality. That's common sense. And we hope that that would be just the first step. We know it's just the beginning of the dismantling of the transgender ideology, because it is so damaging to youth and families, and ultimately takes away their fertility and their sterility, and they become sterilized. And so we could go down the whole pathway of, why would people want to do that? And I'd rather not get into that right now. It sounds so evil, but it is. I'm smiling, but it is an evil philosophy to trans these kids.
Yes. Well, the Cass report from the UK underlines the lack of scientific evidence that puberty blockers and cross-sex hormones are reversible and cause more physical and psychological damage. The report has been the impetus for other nations to ban these treatments for minors under 18. Now, I don't know when we're going to catch up, but apparently other people have agreed that this is not a very good idea.
Well, the Cass report just compiled a lot of research that had been going on in other countries, especially, but in America also, that documented that none of the interventions that are advocated as part of, quote, gender affirming care, used loosely, are beneficial. They do not help these children and youth. They do not decrease the risk of depression and anxiety. They do not decrease the risk of suicide. And that's huge because these parents, as I said, are threatened with the idea that if you don't allow your child to transition, they will commit suicide. That is not borne out by the literature. So so because of the Cass report and because of studies that have been done in other countries, the United Kingdom, Scotland, Denmark, Finland, and even Sweden have put pauses and stopped their promotion of the four major things that have been promoted to help these children, quote. So one is social affirmation. Social affirmation, I want parents to know this. It is not a harmless intervention. It is not harmless to let your little boy dress in girls' clothes and call him a girl's name. What you are doing is you are the adult in his life who he trusts to teach him truth. And so are physicians and teachers. And if the parents and physicians and teachers are saying to a child, you're right, you're not a little boy, you are a little girl, and allowing him to dress like that and be called by girls' names, they're conveying to him, you're right, you were born in the wrong body. What a horrible thing to convey to a child, and it's not true. The other thing about social affirmation is children who are socially affirmed are much more likely to go on then to puberty blockers. So it is not a harmless intervention. It's not harmless. It is an intervention, and it's damaging. The next intervention is puberty blockers, and puberty blockers stop the onset of normal puberty. Well, there are many problems with that, but one of them is that 85% of children, at least in studies, at least 85% of children who feel uncomfortable in their biological sex at the beginning of puberty, if they're allowed to go through normal puberty with the nice elevation of the sex hormones that normally happens, they will end up at age 18, 85% of them feeling comfortable in their biological sex. So we should not be interfering with that. We should allow them to go through normal puberty. And even the Endocrine Society and the American Psychological Association, which, quote, promote gender affirming care, they say, be careful, don't do this early in childhood. So why are we doing it? Well, that's puberty blockers. And puberty blockers in and of themselves are going to keep that adolescent brain from growing, developing normally, integrating all the little neurons that normally happen during the maturation of adolescence. And they have their own side effects. So Lupron's package insert says it can cause emotional and mental health concerns. Sure. So again, a reason not to use it. And the children who get puberty blockers, 95% of them at least are going to go on to receive cross-sex or wrong-sex hormones. And that's when you give a girl testosterone, and you give her incredibly high doses.
These medicines, I'm sorry to interrupt you, but these medicines, have they been tested enough to know that besides changing their psychological thought process, any other physical things? I mean, does it cause heart problems? They must have some other side effect. You can't be giving these kinds of strong pills and not have cause headaches or whatever, because we're always warned on TV, here's a new medicine.
Yeah, the whole list of complications.
A list of things that might happen to you if you take it.
Right. Well, Lupron is one of the puberty blockers that is used that stops puberty. And we know it causes a loss of bone density. And it is during adolescence that children and youth acquire their bone density. They need that for the rest of their lives, especially girls. We know that there are going to be psychosocial milestones that are going to be lost. How can they be? Their developing brain needs that. The girls need the estrogen, the boys need the testosterone. There are receptors in the brain cells for each of those hormones. They're waiting to be stimulated, girls by estrogen, boys by testosterone, and there's a little mix in there. Yes. But the most important thing is the brains are waiting for this. They're getting ready to mature. Sure. And it's being paused. And how do you ever get that back? We don't know. There have been no long-term studies But what we do know is in 2022, one of the FDA clinical team leaders for endocrinology did a review of these Lupron and puberty blockers for the FDA. And most of those drugs had been used for children who had a medical condition where they needed that medicine. But there were some transgender children in there who were being given the drug off label. And what she basically, I've got her email in front of me.
Off-label, what does that mean, off-label?
That means the FDA has not approved these drugs to be used in transgender children. And she admits in an email, I've got it in front of me, we did find increased risk of depression and suicidality, as well as increased seizure risk. And so they ordered a safety labeling change. Listen, the FDA knows these drugs are not helpful and are dangerous.
Yeah.
The cross-sex hormones, the wrong sex hormones, yes, you are right. Those can cause, for males and females, an increase in myocardial infarction.
And how do we know maybe not even cancer long term? I mean, I don't know.
Yes. There may be some increase in cancer. It can cause strokes in men who get estrogen. They get more gallstones. Women are more likely to have blood clots. You know, it's damaging.
Yes, yes.
And
well,
then,
yeah. Well, you know, my feeling is that a lot of times parents are not aware of what's going on. That's why they have to see what their children are doing online and what's happening in school, and they have to pay attention to changes in their children, not eating, losing weight. I think there's also an element of harassment too, because there are other children in the school who are, let's say, have a normal attitude towards themselves and aren't having any of these issues, and are not subjected to any of this easily. There is harassment going on because suddenly one day the guy who was wearing his jeans and his flannel shirt is now wearing a dress. And so that's a psychological thing too. And then they go home and, you know, say to their parents, you know, so-and-so was, you know, pushing me around or whatever. And this is another thing. All of these things are a terrible mixture to have our children have to accept. The parents and their attitude, the school and their attitude, the library book department and their attitude, and the presentations that are being made. The confusion that it causes and the embarrassment is enough to send people off into taking other kinds of drugs because they're depressed, or taking their parents' drugs from the closet because they know their mother takes something for depression or whatever. So this is a brew that has to be stopped. So I guess my question to you would be, what would be a first step that a parent would do? A change in their child, an attitude, a conversation? What would you say would be the first thing a parent should do if they feel that their child is being presented with the wrong indoctrination, information, etc.?
well, I think parents start right when they're toddlers, you know, making sure they know the right names for their genitalia, and when they're doing their potty training, just saying, you know, using the right names and the terms so the kids feel comfortable coming to them and talking to them. I think in preschool and kindergarten, the parents need to confirm you're a little boy. And little boys, sure, boys can play with dolls. Boys can do all these things, but you're a little boy. And just as we sort of tolerate when a little preschooler or a little toddler pretends to be a kitten or a doggy, you know, for a little while, it's okay. And you let them do that. When they're 4 and 5 years old, you're not a little kitty anymore. You're a person. And,
yes.
You know, we confirm to them their sexuality. And it's all about allowing children to, in a sense, experience life and be confirmed with truth from their parents in whatever area the parents confirm truth, and have a loving, nurturing relationship with them, but also setting boundaries and limits and letting them know when you can say no. That's a whole nother topic. And then as they if you are having that kind of nurturing, loving, caring, but setting limits relationship, you continue that on into their middle school and high school so that you are aware of everything. And there's some lovely studies out there that parents who are involved in their children's lives and aware of everything they're doing, who they're texting, what they're reading, those children are actually protected by that parental oversight. And I want to just mention, you talked about the depression, and it's really important. Most of these youth who choose to transition have had previous emotional or physical or sexual trauma. They've had adverse childhood experiences, and they often have underlying mental health concerns like depression and anxiety. Or unfortunately, children who have autism spectrum disorder are at much greater risk for being encouraged to transition. And that's really important for parents to know. If your child appears to be depressed and, unable to get up in the morning and, not sleeping well, those kinds of things, I would normally say, please go talk to your physician, but be careful, but get help from somebody who is going to address the underlying concerns of those mental health concerns and use the psychotherapy appropriately.
Sure. Well, I've said this before. I'm quite surprised, given all of the HIPAA regulations that we have for ourselves. We always have to sign off on something, and who can get this information and, disseminate it out as necessary, usually to your primary care physician and your spouse and whoever. But my thing is how come these schools are able to simply sort of take over the physical future of these children without, it seems to me as if a girl is going to have breasts removed, let's say at 10 years old or whatever, or a boy is going to have his genitalia changed. That, I always say, well, where's the HIPAA thing? I mean, have the parents given the okay to do this, to share this information? Because you just don't go into a hospital and have major surgery without the proper people knowing. And it would seem to me that if your physician has been someone that you've trusted right along, your pediatrician and so forth since the child was a baby, it seems to me but that never gets quite clarified. It's kind of like, oh yeah, well no, it's fine if I know. So that piece has never been clarified for me. But I do want to mention that we have a good friend. She's a transsexual woman. Her name is Christine Rebstock. She has been exceedingly supportive of our position on this and how dangerous it is. And it's because she experienced the trauma of her desire to want to become a woman. So apparently it started, she noticed her attitude in her teens, I believe, maybe a little bit earlier. And it continued throughout her life, and she really didn't know what to do about it and was confused about it and so forth. And she didn't come out until she was about 52 years old. Now, she was very involved in sports. She was originally a guy, very interested in sports. She actually did a lot of media work talking about sports and so forth. But she was into a point in her life where she said, I have to come out. I can no longer hide who I really am. And when she got to that point, she wasn't sure how her friends, her family, and her spouse, because she was married to a woman, would take it. And so she had these pill blockers and experienced all this and decided one day that she was going to go into the garage and commit suicide because she was so confused about it. And then somewhere along the way, I guess she said, this is kind of stupid, I can't do this. And fortunately for her, she was able to change then, and she fully dresses as a woman now. She's a very kind person, a very understanding person, and a very good business person. So she's got common sense. She's got the ability to navigate the world and be able to present herself properly. But her partner accepted it, and apparently that's been going well. So I wanted to bring that up because she said this is most important, that when some of these feelings come across to children, when they feel this indoctrination is starting to have an effect on them, she said that most adolescents will grow out of it if you leave them alone. But if you're pushing them over the edge and it's becoming the trendy thing to do, or one day I feel like a girl, one day I feel like a boy, she said, leave them alone and let them go through it until, I think you even said, about age 18, when you would have the, I guess, authority to say to yourself, okay, I think I'm going to go ahead and transgender myself. But you can't start doing it at 3 years old. A 3-year-old doesn't know what it wants for breakfast. It doesn't know what clothes it wants to wear today because it's confused. 3-year-olds don't know, and they are so susceptible. And what I can't believe is if they really trust their parents, why they wouldn't listen to their parents more than they would listen to some teacher in school.
Well, those are both authority figures in their lives. Let me answer, I think, your question about where did this come from, that children could be, children have been taken away from their parents by the courts because the parents did not want to approve of allowing them to transition. And so this started back with birth control and abortion. And it really became prevalent after sort of 1973 and the abortion decisions, because then youth who were presenting at school pregnant and wanting an abortion, the whole concept that reproductive health or sexuality issues were considered outside the realm of, well, they were considered confidentiality care. And so the parents were not given that information. If a teenage girl went into her doctor and wanted a prescription for birth control pills or wanted to be referred for an abortion, that was confidential care. And from that, it's grown all this.
Okay. Well, Dr. Anderson, our time has gone very quickly. Is there any contact information that you can provide if people want to write to you or be in contact with you further?
Sure. So at the American College of Pediatricians, you can go to our website, acpeds.org, and you can contact me. Also, we called out all of the medical professionals organizations in America last year when we launched our Doctors Protecting Children declaration. And you can see that at doctorsprotectingchildren.org. You can sign it as a concerned individual or a healthcare professional. You can sign anonymously. Great. And we have people from over 70 countries that have done that.
Terrific. That's terrific. Well, I want to thank you for your time today, and I want to remind our viewers that you can see this segment on www.ctvalleyviews.com, and you can see all of our programs there. It's been a delight to speak to you today, Dr. Anderson, and hopefully we provided some important information to parents.
Thank you.